Hi, everyone. Welcome, and thank you so much for joining me today. Today, I'm going to be talking about the GI map tests and how to understand them, who should be taking them, and just a deep dive into how we can understand our gut health better. So, first, I am going to just briefly introduce myself. My name is Jessica Mantell. I'm a licensed dietitian, a certified nutrition specialist, and I do specialize in gut health in my private practice called NextGeneration Nutrition. I work with people who are undergoing difficult GI conditions, autoimmune disease, hormonal imbalances, and other chronic issues. And I create personalized nutrition plans. I use testing in order to get to root causes of issues and help using nutrition and lifestyle to overcome those. So, thank you again for joining me today. Going to introduce the GI map. What is it? If you've heard of it before and you're not sure it's for you, this is a great way to see if this is something that you'd like to do by looking at a sample test. And I'm going to break down some of the sections for you. The GI map is an advanced stool test that goes beyond the standard gut testing. So maybe something that your GI would give to you if you went in for a visit and you were experiencing gut symptoms. It's giving us a comprehensive look at your microbiome, your digestion, if there's any pathogens, and if there's a lot of inflammation present. So instead of guessing by using this test, we can get data on what's really driving your symptoms, getting to the root cause, whether your symptoms are bloating, IBS, food sensitivities, intolerances, or even hormonal imbalances. So, in my practice, I use this GI map all the time as a key tool in our gut health programs to uncover the root cause, to build very targeted protocols for gut healing. And by combining this with functional nutrition strategies, we're able to create tailored plans to address what your unique gut symptoms are because everyone looks a little bit different. So, of course, you could feel your best and faster. So, if you've been struggling with digestive issues and haven't yet found real answers, this test could maybe be your missing piece. So, um, this test, for those who like to geek out, this uses DNA analysis to actually assess our gut health. So, again, this allows us to look at pathogens, beneficial bacteria, digestive markers, our immune responses. And what I really like about this as well is it can be used as a baseline for our overall health. So, we know that our gut is connected to every system in our body. And we can take a look at our gut to identify if there's any imbalances before issues become even bigger. So, when you ask who could benefit from a GI map test, my answer is everyone, especially those who are experiencing the classic gut symptoms. So, what you would think most people come to me with bloating, either IBS, constipation, diarrhea, or mix, reflux, IBD, autoimmune diseases, but also there's a lot of non digestive symptoms that might be linked to your gut. Things that you might not think, such as fatigue, brain fog, anxiety, depression, mood disorders, skin health, autoimmune diseases again, stubborn weight or difficulty losing weight, food sensitivities, poor immunity, and getting colds frequently. So it doesn't all have to do with these traditional gut symptoms that you might think of. So for those who aren't experiencing the obvious gut symptoms, but there's some underlying imbalances in the microbiome, you could still be getting inflammation, poor metabolism, immune function, dysfunction. So this test can give us answers about what's really happening in the gut. And what we do is help provide a roadmap to optimize your digestion, immunity, and overall health. So I'm going to start by going to this first page. I've kind of just taken a sample test and copy and pasted this first page here, which is looking at gut pathogens. So these are the unwanted guests that we can find in our gut. And this could be bacteria, viruses, parasites. We all have them in very, very small amounts. This is what our microbiome is made up of. But they should not be hanging around in large amounts in our gut. And the GI map can test for these even at a very, very low level, because even if it's not showing up in a big way or taking over, it can affect our digestion, immunity, and overall health. So, how do we pick up these things? We see bacterial pathogens, parasitic pathogens here. We can, this could be from travel, having contaminated food, water, poor hygiene. We can even pick it up from our pets. We can get it from eating undercooked or contaminated food. Like if we go to a restaurant and we have a piece of lettuce that was contaminated or a piece of chicken, we don't always know where this comes from. Sometimes with my patients, it's very obvious that it comes from, they went on a trip to this place and they came back feeling terrible and they had indigestion, diarrhea for a long period of time. Maybe we know, but maybe we don't. Can come from all different places. So, what are symptoms of some of these gut pathogens? Of course, digestive distress, diarrhea, bloating, nausea, cramping. You could be getting unexplained fatigue, skin issues like acne, eczema, rashes. Your gut health and your skin are very connected. Brain fog, mood swings. So, some of these pathogens can actually produce toxins that mess with our neurotransmitters and therefore have a huge impact on our mood. What if, we see that these are overgrown but not in a large amount, small levels? The tricky part is that they don't always show up in huge amounts. So they can hide, they can cycle in and out of detection. Even at very low levels, these pathogens can cause chronic inflammation. They can disrupt your gut lining, they can disrupt your microbiome balance. So that's why testing is so important, because these are so, so sensitive. We can pick them up even if they're not very, very overgrown. We can see even if they're mildly overgrown. So just because it doesn't fit a standard doesn't mean that it's not there. And by identifying what's in your gut, we can create a plan to help eliminate these bad guys and rebuild your gut health. And we can do this with targeted nutrition, supplementation, antimicrobial strategies, lifestyle. So there's so many things we can do here. I want to show you next one of the most common gut pathogens that I see in my practice with people going through very uncomfortable gut symptoms almost every time they eat. And this is called H. pylori. Some of you have heard of this before. It's, again, super common. It's linked to stomach ulcers, acid reflux, bloating, inflammation. And what I love about the GI map is that it uses DNA to not only confirm the presence that H. pylori is there, but also we can see, if you have certain, if that H. pylori has certain DNA that's antibiotic resistant. So we can see below on this chart, on the H. pylori antibiotic resistance gene chart, if there's certain antibiotic strains that will not work. So that's really cool for the treatment plan. I don't always treat H. pylori with antibiotics, but there are so many other ways to treat H. pylori which are just as effective as antibiotics. So if you're coming in here confused about how to treat your H. pylori, we have many options for you. Also, with H. pylori, again, it's really important that we can pick up even just a mild overgrowth, because this can cause symptoms. Sometimes it doesn't need to be above the reference range in order for you to treat it. If you're symptomatic and it's still below the reference range, I may treat that. So this is a really beneficial test that we can see. The next is your commensals. So these are your beneficial bacteria. We can see so many different things here. We could see if we have too much or too little of our good bacteria. We want to be in the middle for all of these things. For example, if we are in this test sample, this particular patient is lacking akkermansia. And we know that akkermansia is so important when it comes to blood sugar metabolism and therefore in weight regulation. So this would be a really great way to treat someone who would like to achieve weight loss or blood sugar regulation, or to reverse diabetes type 2. So I think this is very useful. We can also see if there's overgrowth species. So sometimes there's always too much of a good thing. If we can see some species overgrowing or more towards the red on the right side, then it's possible that this person is experiencing SIBO or small intestinal bacterial overgrowth. So this is a great way to see what the status of your good bacteria strains are. Um, if it's very low, we want to, for example, increase diversity, prebiotic foods, resistant starches, probiotics. And if there's an overgrowth, we may want to add antimicrobials, biofilm disruptors, and so forth. So I would guide my patients towards those. Okay, so the next one here, we're looking at opportunistic bacteria. So these bacteria, very normal for us to have in our gut. However, if they are above the reference range, um, this could cause a lot of inflammation. See, of course, there's too much of any good thing. So when these tend to overgrowth, we could see a lot of inflammation. These bacteria strains can cause a lot of bloating, inflammation when they are at high levels. So it's really important to make sure that we're checking to see the balance here. A lot of times I can see patterns with the overgrowth bacteria in the symptoms. So maybe someone who has an overgrowth of Morganella may experience a lot of headaches. And some people with staph or strep could experience could have H. pylori overgrowth, low stomach acid, reflux symptoms. So this is a really great way that I can see what types of opportunistic or bad bacteria is growing in the gut. Okay, next are these fungal and yeast markers. So the GI map provides a detailed analysis of fungal and yeast overgrowth, including candida, which can contribute to a lot of bloating, brain fog, fatigue. A lot of my patients who are going through candida are experiencing a lot of sugar cravings and just persistent gut issues, because yeast can be opportunistic. So that means that it's thriving when the gut microbiome is imbalanced or your immune system is weakened. So the GI map can help determine if overgrowth of these fungal or yeast is playing a role in your symptoms. So beyond just detecting the presence of these organisms, the GI map also can measure their levels. So we can see if it's more of a mild imbalance, or we can see if it's a more aggressive overgrowth that requires a more aggressive intervention. So this allows me to create personalized approaches using targeted antifungal strategies, of course, dietary adjustments, and gut rebuilding protocols to restore the balance and prevent reoccurrence, which is really important. And last but not least, we can see the intestinal health markers. There's a lot of really important markers here, and it helps us understand the status of your digestion, if there's inflammation, your gut barrier integrity, and how you detox. So these markers here can give us insights that allow us to, or can help us pinpoint the root cause of these common symptoms that people come to me, like bloating, food sensitivities, hormonal imbalances, IBS, or irregular bowel movements. So the first marker you can see all the way at the bottom is calprotectin. And this is a marker of intestinal inflammation. So oftentimes, if you are experiencing a condition like IBS, IBD, or just chronic gut irritation, high levels will suggest the need for a deeper investigation into this immune activation, or investigating what's going on in the gut. Next is secretory IgA, or as we call it, SIG-A, which is a key indicator on the gut immune function. So this is where we want to really see something in the middle here. If it's too high, this can suggest an overactive immune response to infections or food sensitivities. So if your immune system is too high, then your body's going to be or your gut's going to be reacting to many different things that come into your system. Remember, your gut is your first line of defense. So if this SIGA is too low, on the other hand, this can indicate weakened gut defense. So you're also more susceptible to infections or gut dysbiosis here. Another key add-on we have here is zonulin, and this is a marker of intestinal permeability, or as you may have heard before, the term leaky gut. Elevated levels of zonulin can indicate that your gut lining is compromised, which means that toxins and bacteria can enter the bloodstream. And when these toxins or other particles enter the bloodstream, your alarms will go off and your immune system can trigger inflammation and also a lot of systemic issues. Next is elastase and steatocrit, which these are digestive enzymes. These markers can assess your pancreatic function. So if you're showing low levels of elastase, then that can suggest poor digestion, absorption of nutrients, which can lead to bloating, not absorbing your nutrition, malabsorption, and other serious GI symptoms. And last but not least is beta glucuronidase. I love that the GI map has this really crucial enzyme, which is related to detoxification and hormone metabolism. High levels of beta glucuronidase can indicate that you have impaired estrogen detoxification. So this can potentially contribute to estrogen dominance symptoms like PMS, bloating, hormonal imbalances, and it can also suggest that there's microbial imbalances that are affecting your liver detox pathways. So I didn't quite go through each one of these markers, but by analyzing all of these markers here in the intestinal health markers section, we can identify hidden dysfunctions in our digestion, our gut barrier integrity, and our detox pathways. And this allows me, as your dietitian, to develop a personalized root cause approach that supports gut healing, which is individual to you and your body, and your gut. We want to reduce inflammation, optimize your digestion, and balance hormones for long-term health. So now I'm skipping. If you want to connect with me, you can go to my website. I also want you to scan this barcode here if you want a free consultation. I offer a 15-minute free consultation to talk you through maybe some of the issues that you've been going through and to show you how we can work together and what that may look like. Of course, nutrition is never one size fits all. That's our philosophy at Next Generation Nutrition. So every protocol we create is for you, personalized to your body, to your health goals. And I want to thank you all for listening to me today, going over the GI map. I think it's really important for people to get tested and identify what's happening in the gut. I also think it's even more important to target the root cause. So instead of masking symptoms, to address pathogens, imbalances, and inflammation. And lastly, personalized nutrition, whether that's nutrition planning, supplementation, and lifestyle strategies to help you heal your gut. So I'm here if you have any questions, if you want a free consultation. I offer in person and in Zoom counseling sessions, and also all the testing can be done at a distance as well. The GI map is a stool test, and you would send it through the mail. So you don't even need to come into the office. My takeaway message is that the GI map gives you clear answers, and I'm here to help you decipher that. Once again, thank you for listening. My name is Jessica Mantell, and please send me a message if you have any questions or interested in our programs or testing.